You know, the federal government sends hundreds of billions of dollars each year to private health insurers through Medicare, Medicaid, and ACA subsidies. It's a massive public investment. And I understand insurance companies, you want to make a profit, you want to do well, and in a free market, I would have no problem with that, but this is barely a free market. In fact, much of it is not. Americans, while this is happening, Americans are paying more than ever for coverage, and they're experiencing worsening health outcomes while that's happening. We spend more on health care than any other country, but have lower life expectancy and higher rates of preventable chronic disease than our peers. At the same time, the nation's largest insurers are reporting billions of dollars in annual profits ultimately supported by taxpayers and families paying higher premiums and out-of-pocket cash. If public dollars are holding up the system, what are the results? Why are insurers thriving while America's health is stagnating? Americans deserve lower costs, better health, and real accountability, not just strong quarterly earnings. Over the past decades, as I mentioned, families have seen premiums, deductibles, and out-of-pocket costs rise year after year, even as insurers have taken in record revenues. I've produced a chart, or have a chart that was produced by the Budget Committee, which shows health insurers' stock prices since 2014 in the last 10 years, and correlates that with rising health care premiums. Or insurance premiums, I should say. So there's a correlation between the premiums and where those dollars are going. It has resulted in higher profits and higher stock prices for health insurance companies. Your margins are protected, but for patients, their experience is higher premiums, higher cost sharing, and more difficulty accessing great care. If we put one additional line, we would literally show declining health outcomes trending downward during that same time period. And you could argue, well, the stock market has done well during that period, but I have another chart. This shows health insurers' performance compared to other sectors, and you'll see that in just a minute. And you'll see that health insurers have outperformed the broader market in multiple different measures. So, Mr. Chairman, I'd also like consent to submit this data to the record.
Without objection.
So, while it's true that input costs have increased, several witnesses on this panel, including United Health, have spent billions on stock buybacks and shareholder distributions. Despite rising input costs, insurers have successfully preserved and grown shareholder value as those costs rose. So it's pretty hard to argue that this approach puts patients first. And as I mentioned, in fact, health outcomes for the average American have not improved and in many cases have worsened. Mr. Helmsley, what evidence can you point to that patients, not shareholders, have been the primary beneficiaries of these business decisions? Your mic, please.
Excuse me. I think that there are a number of points. One thing I would offer to point out is that we participated in the ACA exchanges for all of its duration, 12 years.
Yeah, and I guess what I will say is this is partly, in some ways, you're responding to the system that was set up, particularly in ACA, set up by Democrats, which has encouraged this or allowed this kind of behavior. Ms. Boudreau, Elevance has grown massively with revenues over $170 billion, operates Blue plans in many states, and owns pharmacy, behavioral health, and other subsidiaries. Families and workers in my district are not experiencing affordability gains. Premiums and deductibles continue to rise, even as companies like yours grow larger. Do you acknowledge that consolidation in the healthcare industry, including your company's expansion into affiliated services, has not resulted in lower premiums or lower out-of-pocket costs for working families?
Congressman, thank you. I appreciate the question about affordability, and I would say our strategy is grounded in whole health. And as we think about our strategy, we have diversified.
Do you think costs have gone down as a result of those strategies for families?
Costs have gone up, predominantly premium, because we are paying more for inputs, and as you identified, the health status has
Do you think
impacted.
Consolidation has reduced the amount of costs that have gone up?
Consolidation actually should take friction out, drive affordability, and drive simplicity.
But it hasn't worked. You would expect, if a marketplace is working properly, that perhaps under consolidation we would see lower or at least slower growing premiums in highly concentrated markets. But that's just simply not happening today. But I see I'm out of time.